I mean, issues around mental health, behavioral health have of course been like prevalent for many, many years. I mean, I think the data shows that 1 out of every 5 American will experience some mental health challenge in their lifetime, but yet there still is so much stigma around addressing it and talking about it. But I really found that as we kind of moved into COVID and then are moving out of COVID, that some of that stigma, I think it's getting better. It's still there. I think it's getting better. And as you were talking about issues in farming communities and what that looks like, I will never forget when I started to hear when I was doing, because I'm on the Ag Committee, so I do a lot of work with Minnesota farm groups, and I started to hear like pork producers and Farm Bureau and Farmers Union say, we want to talk about mental health. And they would say, we have a new project focusing on farm stress.
I'm Roy Kammer. I'm a faculty member in the Alcohol and Drug Studies program, and I'm part of the Center for Rural Behavioral Health. We're a team, so we all help with many parts of the center, but I most specifically work with our education outreach. So we do trainings to promote workforce development. In December alone, we trained over 400 individuals between our clinical training day, multicultural supervision training.
How many did you say?
Over 400, so about 450. So lots of training helping to support people get their licenses, maintain their licenses. I appreciate your comment about the connection between food and health. We have a training coming up later this spring that focuses on nutrition and mental health.
In the community
Yes.
this morning, and but on behalf of our over 14,000 students, our 1,600 employees, we welcome you to our campus, and we thank you for your advocacy on behalf of the university. We just came out of a really exciting period last year in developing our new strategic plan that takes us through 2030, and it really indicates that we will be a university, or become a university that provides lifelong learning for students or learners, and provide access to an affordable education. We are and sometimes this works against us, we are the lowest tuition price institution in the system. It's a double-edged sword. It does create amazing access for our students, but it makes it really, really challenging for us to meet some of the other demanding needs, such as mental health, such as ensuring that all of the students have all of those wraparound services that they need, because we are a very lean organization. We are committed to becoming leaders in transformational learning and generating inspired actions, such as the Main Street Farming and such as the Center for Rural and Behavioral Health. We're going to be nimble, and we're going to be innovative, and we're going to be great stewards of the resources that we do have. And we're going to be a community of care where all are welcome, and we create a sense of belonging for everyone. These are just 2 examples of us meeting our new strategic plan. We are extremely excited about it. As I was going back and refreshing my memory on what we had written, I was like, oh my God, this is so timely, because in addition to these 2 amazing centers and programs that we'll have.
Megan Mahold, and I am an interim associate dean of the College of Allied Health and Nursing, but primarily here because I'm the interim director of the Center for Rural Behavioral Health. Among the other initiatives that are talked about with my colleague Paul and Roy, primarily my time has been spent developing, using the framework that had developed, and putting that into motion for our mental health clinic that will be established in our community.
Ed Schuntweiler, I'm the founder of the Center for Rural Behavioral Health and currently a faculty member in our Department of Health Science. I'm very grateful for your support and also your team. I think we have to acknowledge Amy has been so instrumental in this process over the past couple of years.
I'm going to have everybody introduce themselves on that.
So your team has just been fantastic. I've been a fan of your advocacy of rural health. I'm a fellow of the National Rural Health Association, and you're one of our champions in that area. And so just grateful to see this work continue and the impact that it will have not only in our community, but hopefully potentially across the state. So thank you so much.
Thank you.
My name is Salia Tucker. I'm the Senator's Economic Development and Central Minnesota Outreach Director.
I'm Jaden Moore. I'm a graduate assistant for the Center for Rural Behavioral Health.
I'm Claire Lind, and I'm an intern in Senator Smith's office in St. Paul.
Amy Johnson-Corva, I'm Senator Smith's Managing Outreach Director. And Jen Basil, Director of Communications and External Relations with the President's Office here, and I will echo what Provost Hood said. President Inch sends his regards and great thanks for being here, and he apologizes for not being able to make it.
Please give him my best. And the reality of the unpleasant reality of the Senate schedule is that we often don't really know exactly where we're going to be as much in advance, and so I know that we organize this so, without a huge amount of warning too. So please give him my best.
Sarah Burns. I'm the Director of Federal Government Relations for Minnesota State Colleges and Universities, so I work at the system office. And I just am here to thank you for your support of these programs and overall the support of congressionally directed spending. I wrote it down because it is tricky between the House and the Senate.
I know. We're trying not to say earmarks.
Right, exactly.
I know.
We're just very grateful for your support of this. We've seen across the system campuses that wouldn't, without this funding, these important programs wouldn't either be able to get off the ground or make an important step to really serve the community, their students, the community, the state. So we're really grateful for this.
Yeah.
Those structural barriers, right? And questions around, things like, is the licensure exam, to be honest, too difficult, or is it too difficult to get to a licensed site, or is it the cost associated? I didn't come prepared for this. It's just a number that bothers me. But over in social work, it costs a student, we did the numbers, $466 to be able to go from that point where they're essentially graduated or nearly graduated to completing that licensure. Right? That's real.
Yeah.
It's real money.
Yeah.
And nutrition and health, so very much in there. The Center for Rural Behavioral Health, sits in the College Valley Health and Nursing, so this is one of our major projects that's going on here now, and very much appreciate your support in putting this forward, because I think some of the key elements of this is going to allow us to train and increase our workforce to serve the rural regions of Minnesota.
Social work currently oversee the research elements of the Center for Rural Behavioral Health, where we have several different projects going right now, and be glad to answer those questions as they come up.
That sounds great.
I'm Colette Drager, and I am here as a benefactor, a utilizer, a farmer, and in which my next two people will fill in. But I'm with the Meadery MN, and we are an e-commerce business that was started by a two-generation farm family, and it's all online, and we directly connect farms across the state of Minnesota with their quality beef, pork, chicken with consumers across the country.
Pretty exceptional part of what the center has been able to accomplish is engaging partners. And so when I founded the center, I said, we're not going to be able to tackle this issue as an institution alone. And so I said, who are the partners? Who should be at this table engaging in that conversation about access to mental health care? And so as I started putting together the pieces, I thought, well, we need to have government support. We need to have the support of the federal government and the state government. And we're grateful for the federal support. And then this past legislative year in Minnesota, we were also given an appropriation for the clinic. But that wasn't enough. I knew that we couldn't just rely on the government to solve this problem either. And so I went to the private sector and searched out partners who wanted some skin in the game, and very grateful for Blue Cross Blue Shield of Minnesota for being our naming partner and putting those initial dollars behind the mission. But I also wanted to engage agriculture. I mean, so much of rural Minnesota is ag, and some of the hardest hit as it relates to mental health have been our agricultural partners. And so just thrilled to bring Minnesota Pork and the National Pork Producers Association on, as well as Compeer Financial. I mean, I think when we discussed our vision and where we were going, they were very excited. And I think that's one thing we're getting right, is engaging everyone to help solve this very complex issue.
Received that other grant that you were graciously working on with Senator Klobuchar. So we truly appreciate that. But I do want to say something as a mayor and the community, that MSU Mankato and South Central with the ag, it is so important, because many years ago, as I know for a fact, a lot of our young people were leaving the farms and they were going out to the cities because it was a big thing. And now, because of this connection, families like the Gensels and so forth, the families are now starting, it's a business again, so it's
Right.
redoing it.
There's a
So
future, there's opportunity.
thank you to MSU, thank you to South Central College also for bringing ag, especially MSU, because this is new to you. So thank you, and thank you for having me here.
That's great.
All right. Everybody else, I want you to introduce yourselves too.
Colette is a rock star. Yeah. Terry Wallace, and I serve as the interim associate vice president for research and the dean of University Extended Campus. Strategic Partnerships currently falls under that role.
Mhm.
And so I work with Tammy and with Mike Hahn, who isn't here today. He is our director of the Small Business Development Center, which
Okay.
has a lot to do with
Yeah.
this work. But I, too, will talk a little bit more when you ask questions. Does that sound good?
Yeah.
Okay.
Sounds great. Thank you.
I'm Tammy Volking. I'm the Director of Workforce Professional Education, which oversees continuing education and customized training for our region. And then purpose of here today is I was on the leadership team for our past MFA grant that we had.
I'm Jean Poppy. I have the pleasure of working with Senator Smith. I'm her Southern Minnesota Outreach Director.
Thinking in my mind about, okay, how can we take the learning of what you're accomplishing here and think about how to apply it in other places in other ways so that these successes can be carried forward. And I'm always trying to think about, okay, how can the federal government be a strong, even a better partner? And just on that note, I want to do a huge shout out to my staff, because I know that when institutions are trying to work through how to apply for these funds, it can be complicated. And I think they do such a great job of kind of debunking that process and helping to understand like how it all works and how it comes together. And I also just want to say that, when we restarted these congressionally designated funding, community project funding, there were a lot of reforms to make sure that frankly, I think some of the abuses of the system, in years past, way before I was in the Senate, aren't there anymore. And so, these funds need to go to community-based organizations, nonprofits, or public sector and institutions like Mankato. They no longer go directly to private enterprises, which I think is a good reform of the system. And so I just want to thank my great staff for making this all possible. And we did really well this year in Minnesota. I think we brought home to Minnesota well over $300 million in projects all across the state to support kind of local initiatives just like this. So that's really great. But okay, so maybe, and I've got my phone here just so I keep track of time. I'm a former focus group moderator, so I like to be organized about how we're doing the timing. But maybe let's, it doesn't really matter, but why don't we start with the Center for Rural Behavioral Health side first. And let me just ask anybody who works in that sector, like, what would you say are it's a pretty big question, but what would you say are the top 2 or 3 things that you think you really are getting right? And then the top 2 or 3 things that you really hope will be outcomes of your work over the next 5 years or so. Yeah, I know that's a big question, but who would like to take a stab at maybe the first of that? Top 2 or 3 things that you think you're really getting right here.
I think we're getting some of the research stuff right.
Yeah.
Trying to ask very applied questions. Currently, we have a project with Wilder Foundation where we're looking at issues around licensure. And it's one thing to graduate, counselors, social workers, LMFTs, et cetera, et cetera. It's another thing to when we Thad actually was able to identify this very early and showed a very strong, identified a strong problem, which is, it's one thing to get the degree, it's another thing to get the license. And in Minnesota, typically, you have to have the license. So, reminiscent of a friend of mine who once said, I went to law school, and I said, so you're a lawyer? And she said, no, because I never passed the bar. So you can have a degree, but you can't practice. Why?